Good evening. My name is James Liu. I'm one of the medical librarians here at the Stanford Health Library. And tonight, I want to welcome the people here in-house in the audience. This is one of our first hybrid presentation since the pandemic. So welcome. And then welcome to everybody who's online dialing in on Zoom. And tonight, we have a really exciting talk. And the topic is how to control high blood pressure for a healthier tomorrow. And I'm excited to introduce Dr. Bahrainwala. Dr. Bahrainwala, she's double certified in nephrology and in internal medicine. And Dr. Wala is also a fellowship trained nephrologist with the Stanford Medicine Kidney Clinic. And also, Dr. Wala is a member of the National Kidney Foundation, and she's also a member of the American Heart Association. So without further ado, let me introduce Dr. Wala. Welcome. Thank you for being here.
Thank you. Can you all hear me okay? And hopefully hear me okay online. Like James said, I'm Dr. Bahrainwala. I'm a nephrologist and a hypertension specialist. People always think that blood pressure doctors are heart doctors, but actually a lot of kidney doctors are also blood pressure doctors. So really, I spend my time taking care of patients with high blood pressure and high blood pressure with kidney disease. I have no disclosures. So what am I going to be talking about today? I will be focusing on what is high blood pressure, why does high blood pressure matter, what are the risks for high blood pressure, what is the target high blood pressure and why, how should you measure and monitor blood pressure, what is severe high blood pressure, and what is new in our field. And of course, I will, this is for you, so I'll talk for maybe 30, 40 minutes, and then we can take questions, and feel free to write your questions in the Zoom chat too for those listening online. So let's start with the first few questions. So what is high blood pressure? Really, high blood pressure is the force of blood through the vessels in your body. And when that is too high, we call that high blood pressure. And medically, we call this hypertension. So I'm a hypertension doctor, and that's just a fancy word for high blood pressure. Whenever you go to your doctor's office or check your pressure at home, you have a top number and a bottom number. You may have heard that we call the top number the systolic blood pressure, which is really your heart's beating and the blood pressure that your vessels see when the heart beats and squeezes and the heart pumps that blood out. That's your systolic blood pressure. That's the top number. That's usually higher. And then between the heart beats, when it's resting, you have a diastolic blood pressure that is a lower number. And we measure this in millimeters of mercury for historic reasons and just standardization. So what are blood pressure categories? There are a few. We consider normal blood pressure when that top number is below 120 and the bottom number is below 80. And once you start climbing up over that 120, we call that elevated blood pressure. That's the category that's how we label it. We start worrying when it's over 130 and over 80 for that bottom number. And this is when we start labeling it as hypertension stage 1, and we call this high blood pressure. Where we really start worrying is when that top number goes over 140. We call that stage 2 hypertension. And when you're like over 180, you may have heard your doctor tell you, hey, you should call us if it's really that high, or go to an emergency room. So these are sort of the categories and how we classify high blood pressure depending on those measurements that you're getting. So why do we all talk about high blood pressure so much? Why does this matter? It's really, really common. Like nearly half of the adult population in the USA has hypertension. And it's higher in men than women. And as you get older, your chances of having high blood pressure just goes up. And if you look at the USA, nearly 70% of adults over age 60 have hypertension. And in spite of it being so common, what is really astonishing is that the control of high blood pressure is still really, really poor. So a lot of patients have high blood pressure, are either getting treatment and they're still, or not getting treatment. Overall the control is still poor, and this is why it is so important that we talk about this. It costs billions of dollars per year, and survey data shows that treatment of high blood pressure is the most common reason for office visits and chronically taking prescription medications. So what are the dangers of high blood pressure? We know that this matters, and how is this harmful to you? It really is a risk factor for other big diseases in the body. How many of you have heard hypertension is a silent killer? Have you heard this or seen this phrase, right? Well, you may have seen signs of this. We always talk about it being a silent killer. And that's because you don't feel high blood pressure for the most part. It may be something that gets picked up in your doctor's office or when you check at home. But it really does affect the major parts of your body and important parts of your body. It affects your heart. It affects your brain. It affects all your blood vessels that are seeing this high blood pressure for years and years. It affects your kidneys. And again, this is where I focus a lot as a kidney specialist. And there are a lot of high blood pressure problems that pregnant patients can have, which can affect mom and baby. So, we talked about how high blood pressure hurts these important parts of your body. But what diseases that you may you may see in your list of diagnoses or that you may hear about does this manifest as? So if you have high blood pressure hurting the heart, for example, you may get blockages in the blood vessels of your heart, and this is called coronary artery disease. You are at a higher risk of then heart attacks, heart failure. In patients with high blood pressure, you can get strokes, you can get dementia. You can also get a lot of significant damage to the blood vessels in different parts of your body, commonly in the limbs. I'll see patients who may have to get amputations, which is parts of their limbs actually cut off, unfortunately, from complications of this. Aneurysms, where you can get like ballooning of blood vessels in different parts of the body. I see a lot of kidney disease, kidney failure. Preeclampsia is a disease that happens to pregnant patients. You can have vision loss, sexual dysfunction. So really you see that hypertension, high blood pressure, this is important. It can really hurt a lot of different parts of the body, which is why we're always stressing, treat it, because we want to prevent these horrible diseases from happening to our patients. So, why do patients get high blood pressure? And the way we think about this is, what are your individual risk factors for getting high blood pressure? And there are two big buckets of risk factors. There are risk factors that are modifiable, which are things we can change, and we'll talk a lot about that. And there are things we cannot change. So the non-modifiable risk factors are, I can't change your family history. If you have a strong family history of high blood pressure, you might be more prone to getting high blood pressure. And like I mentioned, as you get older, you're at a higher risk of getting this. So I can't change that. But what are the modifiable risk factors for high blood pressure? And what are things that might exacerbate your high blood pressure? And this is what we spend a lot of time with our patients talking about. And I'll spend some time talking about this. So one, obesity. A lot of the American population struggles with obesity, and this is where you are a certain weight relative to your height. And we know that obesity can affect a lot of things. It can affect high blood pressure, can affect your heart health, your kidney health. So really working on your lifestyle to help with losing weight. But also I will mention there are new medications. How many of you have heard of like drugs like Ozempic or Zepbound, where there are all these new medications on the market that help patients with weight loss? So if that is something that you're wondering about, I would say ask your doctor, hey, am I a candidate for this? Is this drug good for me? Because it can help patients lose weight. physical inactivity. So really, I recommend even a 30-minute walk every day at minimum, right? Whatever you can do to spend less time sitting and more time walking will really help get your blood pressure down, and it goes hand in hand with point 1, right? If you want to lose weight, exercise also helps with that. Obstructive sleep apnea, have you heard of this condition or heard of CPAP machines ever? So, if you have a bed partner who complains that you're snoring, or you stop breathing in the middle of the night, or you have high blood pressure at nighttime, or you have high blood pressure that is hard to treat, we usually do consider getting a sleep study or a sleep test where you can make this diagnosis. And basically, this is a condition where when you're sleeping, you're not getting enough oxygen to your heart, to your lungs, to your body, and it sort of puts you in a state of stress and raises your blood pressure. It's not fun wearing those masks. Patients really don't like it, but there are newer treatments available, and it's just something to make sure that if you have it, you talk to your doctor about the best way to treat it. We'll talk, I'm sure everyone's heard eat less salt if your blood pressure is high, so we'll talk about high sodium diet in a bit. Alcohol intake, I always recommend, the less the better. Really avoid more than 1 drink per day, but cutting back alcohol can help lower blood pressure. And a lot of these things go hand in hand again. Eating healthier, being active, losing weight, and all will help blood pressure. Medication, so there are a lot of medications that you may buy over the counter or drugs that your doctor gives you that might actually raise your blood pressure. So I always recommend, really asking your prescribing physician when you're getting a new medicine, like, hey, could this affect my blood pressure or interact with my blood pressure drugs? And there are drugs over the counter that not everyone knows about that can raise pressure. So for example, very common painkillers like ibuprofen, Motrin, Aleve, Advil, these can all, if you take them in higher amounts or regularly, can raise your blood pressure. Decongestants, I'm nursing a little bit of a cold right now, and if you take decongestants, some patients can be very sensitive to that and get higher pressure. There are medications that are that can be used for mental health, for example, for anxiety, for depression. Some of them can affect blood pressure. So really, again, it's hard to predict which patient will or will not have a response to this. But if you're taking a new medicine and it can raise your blood pressure, I would say keep a close eye on your pressure and see if you're one of those patients. For a lot of women who take estrogen hormonal therapy, estrogen can raise blood pressure. So again, just being familiar with what's out there and what could potentially affect you. And just in general, smoking, diabetes, high cholesterol, a lot of this goes hand in hand with high blood pressure, with heart disease, stress, poor sleep. These can all also contribute to high blood pressure. Okay. So regarding sodium, how many of you here look at labels and read sodium? That's great. So, how should we be reading sodium on our labels? And, one thing that might be helpful is looking at the percentage of the daily value. So really, we recommend that your 24-hour sodium intake should be under 2,300 milligrams. And a quick way to look at your labels is if it's like less than 5%, it's likely safe. But if it's more than 20%, it's likely high. But really, most of the sodium that we eat actually doesn't come from the salt that you're adding at home. It's really from processed food, canned foods, prepackaged foods. So really, the more you're not eating fresh home-cooked food, the higher chance you're getting a lot more salt in your diet. One thing I recommend is if you're initially trying to really watch the salt in your diet and trying to figure out how to do it, really using, there are sodium trackers available online. You can really just keep track. And once you do this a few times, you'll figure out and you'll know your body what's high, what's low, and what I can eat to keep my sodium down. I won't be talking a lot about diet, but you may have heard of the DASH diet, which is the Dietary Approaches to Stop Hypertension eating plan. And it's really whether you're targeting heart health, high blood pressure, obesity, really just making healthier choices and eating more whole grain foods, fresh fruits and vegetables, less red meat, more nuts, really just staying away from the stuff that is really hard to resist, will definitely help your blood pressure. So we talked, about what is high blood pressure, why does it matter, what are some risk factors for this. Now let's talk about why does your doctor aim for a certain blood pressure, and how should you measure and monitor your blood pressure to know you're meeting this target. So how many of you have heard of this goal, or have you heard different goals from your doctor? So, what should your number be? And in some cases, your doctor may individualize for you, but our guidelines for most patients who have high blood pressure is to get it under 130/80. One common question I may get is it the top number that matter? Is it the bottom number that matter? They both usually go hand in hand. If you have just the bottom number that's high, we may just keep an eye on you. But really the top number, if that is high, which will, like I said, likely go hand in hand with the bottom number being high, we really try to get you below 130/80. So really looking back at those categories, we want to get you to normal or elevated with lifestyle changes and medications. So why do we aim for under 130/80? Where did this number come from? The purpose of this slide is just to show you that over the years, we've had lots and lots of big studies and trials that have looked at, what blood pressure range is good or bad for patients. And over the years, our recommendations to patients has changed. I mean, at one point, 160 was acceptable, 140 was acceptable, 150 was acceptable. But then we had this big study that came out in 2015 called the SPRINT trial that really really influenced our current guidelines for how we treat high blood pressure. And really, this study, it enrolled lots of patients, and it enrolled patients who are elderly, who are of a higher risk of heart disease, who have kidney disease, and we put the patients in two groups. We said there are groups of patients where we'll just keep your pressure, under 140 is good. And then there were patients that they were targeted to a more aggressive goal of less than 120. And the findings from the study were dramatic. I mean, there was a significant amount of patients who were found to have less heart disease, less stroke, and most importantly, your risk of dying was dramatically lower if we pushed your blood pressure lower. So, over the last decade, our current guidelines and expert opinion, and especially influenced by this trial, have led to this recommendation of less than 130/80, again, because it helps protect your heart and helps prevent death. So, what are our current guidelines for how we treat you? And I'm going to show you our doctor algorithm that we use on how we approach high blood pressure. So again, just to remind you, those were the categories that I had mentioned. Normal and elevated is sort of the range where we're trying to get you to, which is like under 130/80. So, if you have a blood pressure, you're going for your annual doctor visit, you're less than 120/80, looking at the far left here, your doctor's going to say, great, let's keep an eye on stuff, healthy lifestyle. But if you start getting into the yellow category of elevated, your doctor might say, okay, your blood pressure is creeping up. Let's maybe push the lifestyle changes more, less salt in your diet, more exercise. Let's follow up in 3 to 6 months. But once you start getting to what we call stage 1 hypertension, now you have blood pressure that's over 130/80. Now your doctor's trying to figure out, is it time for a drug or not, right? And these are discussions you're having with your doctor to try and figure out the next steps. There's this calculator that you may or may have not heard of, which I've put up here, this ASCVD. Your doctor can basically calculate based on certain things about you, like your age, your sex, your blood pressure, your cholesterol, do you smoke, do you not smoke, and figure out what is your risk of having some sort of complication and heart disease. And if you have a higher risk of having a heart problem in the next X amount of years, then they might say, okay, I think we need to be more aggressive and start you on medicines. Versus, okay, you don't have a family history, you don't smoke, you're young, maybe we just push more lifestyle. So, these are nuanced and, individualized decisions, but that's kind of the tree that we're following. But once you get to that 140/90, it's highly likely that your doctor is going to say, hey, it's time for a blood pressure drug, okay? So, so again, just, we aim for under 130/80. This was influenced by big studies that we did, and this is sort of the rough tree that we follow when we are treating our patients, okay? So so now I've told you that this is, the number that we want to see, but how do we know this is your blood pressure? Like, how do we measure it correctly so that we can make important decisions regarding adjusting your medications? So, this is a really great infogram that I attach to all my patients, summaries when they leave my clinic, but it's a really good reminder on how you should check your blood pressure. You should be sitting in a chair, your back should be supported, your legs should be uncrossed, they should be touching the floor, your arm needs to rest on a table, the cuff has to be at the same level of your heart. Don't smoke or exercise or drink caffeine for 30 minutes before. There's a lot of important information on here, but it is important that we get an accurate measurement so that we know what your blood pressure truly is when you're resting, because again, this is influencing your treatment, right? In our high blood pressure center, I'm part of the Stanford Hypertension Center, we use this special machine, and this method that we follow was what was used in these big studies that influenced our guidelines. And you sit for 5 minutes, and then we get 3 readings, 1 minute apart. How many of us have gone into our doctor's visits, mad about the parking or stressed about the visit, and we rush in, your pressure's really high, but then if you sit and they check it again, it might come down. So again, a lot of these pressures, if you just aren't checking it the correct way, that clinic pressure might not be correct, and we do know this, okay? So really you want to do your measurements for blood pressure like this ideally in a clinic, but not all centers or clinics may have this machine, but that's why it's important to follow these methods even at home, right? So why should you measure your blood pressure at home? For just some of the reasons that I mentioned. And when you are, another question a lot of patients ask me is, doctor, what should I buy? I have no disclosures or affiliations with any company, but this is the machine I recommend. It's the Omron machine. It has a lot of fancier versions, like there are some of the Omron machines that actually do measurements like this machine. Some of them, have Bluetooth connections and link to your phone if you want to generate cool reports about your blood pressure. But even if you just get a basic one and track your blood pressure, that's great. There are patients who have high blood pressure at home, high blood pressure in clinic, and that's high blood pressure that's not treated well, right? So that's this red box here, the sustained hypertension. But there are patients who go into clinic and they're stressed and their blood pressure is so high, but then you check it at home and it's great. So that's the white coat hypertension you may have heard about. So that's where I'm saying, I'm not touching your medicines. Great, if your pressures at home are good, I don't care about this high number today when you're stressed and you were mad about parking. But there are a group of patients, believe it or not, who have like masked or hidden high blood pressure, where you have normal blood pressure in clinic and it's high at home. And these are the patients I worry about, because if we aren't checking your pressure at home, we're gonna miss you and we're gonna miss treating you. And then of course, the patients who are normal in both scenarios would just have normal blood pressure. So really, checking pressure at home gives your doctor important information that guides your treatment. We don't want to respond to that high pressure in clinic and give you too much medicine, but at the same time, we don't want to miss masked high blood pressure at home and give you too little medicine. Really consider calibrating your machine if you aren't doing this regularly, which basically means take your blood pressure machine to any doctor's office, have them check it against their machine, and just make sure it matches, okay? And a really important piece of information I will give you is that your out-of-office blood pressure is actually more strongly associated with disease and risk of heart disease than that high clinic blood pressure, okay? So again, I cannot emphasize enough the importance of checking blood pressure outside of your office visits. There are really good, again, trackers online and sheets like this on the American Heart Association. I ask all my patients to keep a little in a sheet with all their medications, over-the-counter supplements, so we can keep track, and just consider keeping some form of a blood pressure log that you can take to your doctor's visits. Has anyone here heard of a 24-hour blood pressure monitor? Oh, yeah, okay. So, this is another way to check blood pressure out of the clinic. It's something we do at home. Certain specialty clinics will offer this, where you basically wear a 24-hour blood pressure monitor. You will get a cuff attached to your arm. You will wear it all day. You will sleep with it. You will wear it all next day. It can, of course, be annoying for patients. It goes off quite often, but it gives us very important information as a high blood pressure specialist. So if your readings at home are like all over the place, if your clinic visit, they're like, why are the numbers just like all over the place, not matching? I might just say, hey, let's just do this and really get an idea of what's happening in your body. Is it high? Is it low? Let's see if your drugs are working. It can give your doctor a lot of important information. So again, not everyone needs this. We just do this in certain specific scenarios, but I just wanted you to know this is out there. It's another way to check blood pressure out of the office. So in our last few minutes, let's talk about what is severe high blood pressure, right? And what causes this? So when I look at all comers for high blood pressure, most 95% of the patients have what we call essential hypertension or primary hypertension or idiopathic, which is just a fancy way of saying we don't know what's causing your high blood pressure, and we just target those risk factors that I can modify. But there is a small slice of patients amongst all patients who have high blood pressure that have what we call secondary hypertension. And this represents the slice of patients who actually have severe high blood pressure usually. So what is severe high blood pressure? It's really when you're needing multiple drugs to treat your high blood pressure. We're getting into 3 drugs, 4 drugs. Pressure's still hard to control. Or you're like a 15-year-old with high blood pressure or a super healthy 75-year-old and suddenly you have high blood pressure. So when I look at the bucket for all severe high blood pressure, a larger chunk of these patients, like maybe up to 25%, actually do have some other reason that's driving the high blood pressure. And there are a lot of specific diseases that can do this, which I won't go into here, but this is when your doctor might worry, or they're like, oh, I'm thinking of this rare disease or this other disease, and that's when you will need more specific testing, okay? So, you might ask, like, when should I come see a hypertension specialist like me? So sort of the patients I went over in the previous slide are the patients that I tend to focus on. So really, if your blood pressure is just stubbornly staying high, you're doing everything, you're walking, you're lowering your salt, you're taking your drugs, or you're having a lot of drug intolerances or allergies, or your doctor is suspecting, hey, I think you might have one of these secondary causes that I need a specialist to investigate, okay? So we talked about, all of these other topics, and I want to mention what is new in the field of treating high blood pressure. So it is an exciting time in my field, and there are new therapies coming out. So one I want to briefly mention is called renal denervation. This is being done at certain specialty centers like Stanford, and it's a procedure to try and treat high blood pressure. It was just approved by the FDA, and it's basically a procedure where you take a catheter that goes in through the leg up into the blood vessels in your belly that feed the kidney, and you actually burn the nerves in that area, which sounds scary, I know, but this procedure has actually been proven to be safe so far with the information that we have. It doesn't hurt the kidneys in any way, but for certain complex reasons can lower blood pressure over time. It's not a cure for high blood pressure. It's meant to be another potential treatment and potentially help patients take less medication. So it's really, really an individual decision, right? Like if I don't want to take medicines, or I'm allergic to a lot of blood pressure medications, if you have healthy enough kidneys and your belly and your abdomen, your anatomy and your vessels are all otherwise healthy, then this is something you could ask your doctor about or consider a consult to just learn about it and see if you're a good candidate. But really, it's the patient that drives this, right? It's some people would rather take more pills. Some people would like a procedure if they could potentially come off pills. Okay. I will mention, that there are a lot of new drugs actually being studied. There is a new one that just got approved for the difficult to control high blood pressure, but a lot of these other medications are still investigational. So in some cases, if you're a patient who likes to be part of studies and be, try new drugs, there are trials going on in most big academic centers. So I just wanted to put that out there that there are new drugs being investigated, and also there's this new procedure for high blood pressure. But that's all I have for you today. I wanted to make sure we had time for questions. And if you could use a few minutes to fill out the evaluations, and even for those online, if you could fill out the evaluation, and I'm here to take questions.
I've heard that, nobody has high blood pressure except for if you do the right lifestyle, because they'd be like, oh, we evaluated people in rural Kenya or in rural China and, I don't know, T. Cole and Campbell or some of these plant-based eating studies and stuff, and they're like, oh, I followed a whole food plan. But I just wonder, is it all lifestyle? Usually if you're taking medications, is it because you didn't live a perfect lifestyle? And one of the things that I also find hard is how do you manage. I think the hardest thing for me is stress, because I did the Omada Health program and it feels so stressful. It's do this, do that, do this, do that, and it's I'm not a professional chef. How do I manage the stress with, and then also coming to the doctor's office is always so stressful. It's your LDL is 150, we need this to be below 100 and this and that, and it's it always stresses me out every time I go to a doctor. They're you gotta lose 10 pounds, you gotta do, and so it feels very, how do you recommend that you, those are my two questions.
Yes, if I heard you right, one is how much can lifestyle be enough of a cure? And for some patients it might, but to also answer what I think I heard as another part was, are medications sometimes needed because lifestyle is not enough? And I mean, even the patient's doing the best they can, right? So I agree that you can't make everyone walk this much. You can't make everyone cut their salt this much. I've had patients tell me, Doc, I'd rather just take another pill than eat any more less salt, So it's really shared decision making. It's unfortunately why some patients will respond a certain way and some others won't. There's so many individual variables that we still don't understand or can't test for. So you're correct. Stress management, diet, weight loss, all of these are so individualized. But in many times, the patient does the best they can. But then I will discuss what drugs we can use, and just always do both. So, it's not easy.
How do people get off? Do people, when they take medications, do they ever get off it? Or is it once you take it, you have to take it forever? Because people are don't take it, once you start, you'll have to take it forever and stuff.
Yeah, that's another good question. The question is, can you come off blood pressure medications once you're on them? And like I mentioned, it is a silent killer with all of these other, scary ways it can affect other organs. So if some patients know that there are lifestyle changes that they can aggressively make, and those lifestyle changes do result in X amount of weight loss or X amount of less sodium consumption, you are correct. I've had patients wean off some drugs for sure. So it is definitely possible. And some patients may be doing everything right, and it just may be their age, their genetics, bad luck, that they can't come off drugs.
So it is sometimes genetic, even if people live a perfect lifestyle, they
definitely
have,
And then it also gets into hey, do you warrant those workup for other causes? I was also I know Jillian wanted also we could pass out. Do you want it?
Right, sure. I'll pass out.
And if anyone has other questions or thinking about.
Questions, and then James will start moderating from the online chat as well.
Sure. We're just going to pass out cards. If you guys have any other questions too, we can write them down.
And Dr. Bahrainwala, welcome again, and thank you for the question. And I see some questions online.
Sure,
People seems to be concerned about the big fluctuation in their blood pressure during the day.
Yeah.
And so they're asking, is there something that could treat that? And also, is it the best time to of the day that can
Yes,
measure your
yes,
blood
yes.
pressure?
I did anticipate that question. Really what matters is a 24-hour average resting blood pressure. So your stress, your activity, a lot of things will cause fluctuations in blood pressure throughout the day. But it can be really stressful for a patient if they check their blood pressure multiple times a day. And for some of my patients, that's just worsening the blood pressure. So which is why in some scenarios, if you find yourself having a lot of these fluctuations, I will say, don't check your pressure. Let me do that 24-hour monitor, and let me see what your 24 average is. And that can be very reassuring for patients because it's that average number that matters. We do understand some fluctuations are normal and expected. Regarding when to check your blood pressure, how often to check it, based on that infogram I showed and what I recommend, is just wake up in the morning, use the restroom, then rest for a few minutes and check it before you take your medications. And that really helps me just know, and is your blood pressure good in the morning based on the drugs you took the day before? And that can be enough, So you don't have to, if it's not controlled, then we might ask for more readings or do the 24-hour monitor. But if you're doing well and your pressures are controlled, just do it once a day in the morning or maybe twice a day. But really the times to really think about when should I do more monitoring would be if your pressure is not controlled, if it's swinging a lot, or if your doctor's just made a bunch of blood pressure medicine changes. Like that is the time to maybe do twice a day readings, capture more data. But once you're doing well, don't stress out about checking it too many times a day because I think that can really hinder your quality of life.
Okay. Here's another question. This person said she doesn't smoke, drink, or do regular exercise. But she noticed that for the last few months, her both numbers have been slowly creeping up.
Yeah.
And she also feels palpitation. Is this a concern?
That's a good question. And of course, it's hard for me to give you individual, recommendations. But I would say if you notice a trend in your high blood pressure or any symptoms related to your heart or breathing, always bring that up with your doctor and get checked out, just given the risks of high blood pressure.
Okay. Okay. And maybe we have some questions from the audience.
Do you have that?
Yes.
I don't know.
Thank you. Okay, the question is, why isn't hypertension included in the blood pressure categories? And what percentage of people have hypertension?
So the question is about low blood pressure. So that is its own disease. So that's where we're not talking about low blood pressure because there are a lot of other medical conditions that can cause low blood pressure. And that is its own out of the scope of this talk, unfortunately, but there are certain conditions that can cause very low blood pressure, and that warrants its own workup, its own testing. But hypertension is it's a diagnosis of high blood pressure, and that has its own treatment. But yes, if you're struggling with low blood pressure or symptoms of low blood pressure, that has some other specific diseases that can cause that, and I would recommend getting that worked up. And a 24-hour blood pressure monitor, sometimes I use it for patients who are worried about low blood pressure too.
Okay, thank you. And thank you. Okay, and the question is, the University of Colorado Boulder published a study that is, quote, IMST, unquote, and it's inhalation muscle strength training, and that it could reduce blood pressure significantly. Has this been collaborated, and any related study or learnings related to that?
I'm sorry, I'm not familiar with that. It was an exercise training.
The devices that athletes use to restrict their
Yeah.
inhalation and exhalation.
Yeah, I'm not sure. I don't know. Nothing that's validated or studied for the general blood pressure population. But who knows? There's a lot of good stuff happening everywhere. So we'll see. But yeah, I'm not sure about the details of that study. Yeah. Any other?
Okay, and let's see. Okay, people wearing those smart watches, are they useful?
The wearable devices, there are a lot of, Microsoft and Apple, all the big tech companies are studying a lot of the wearable devices. At this point, at where we are in February 2025, I would still not recommend any of them because there's not enough data and not enough, these devices have to go through what's called a validation process to really make sure they're safe to use. I would be nervous if you only use that, if you want to use that with a regular upper arm cuff and see if it matches. But I would not solely use a wearable device for blood pressure at this point. For heart rate, it's fine, and it's even been useful with heart rate and irregular heart rate, but not for blood pressure. Not ready for mainstream use yet.
Thank you. Okay. I noticed that my blood pressure can change 5 to 10 points. I slow my breathing, calm down, and but is that
like which one's accurate? Like,
yeah, right.
Yeah, right.
Yes.
And that's
Thank
a
you.
very common question. Really, it's a true resting blood pressure, and I think all of us have just this white coat effect, even when we're checking our own blood pressure. It happens to me too. And it's like rest for a few minutes, and then it drops a few points, and that second number is a good, accurate pressure. So just use that. If you're noticing your first reading, and then you're resting, and it's still high, then I would say, okay, both are high, then it's a high reading. But if with resting and a little bit of deep breathing, if your pressure is coming down, then I would just use the lower reading. But really, that's why the other method of doing a couple of readings spaced out and taking an average is also really, really helpful. Because it's just very common that when we first check our blood pressure, it's high, and then as we sit and breathe and calm down, it drops down. Yes, that's a great question.
Okay. And then let's see. Are there particular cases of classes of hypertension medicine, for example, calcium channel blockers, angiotensin receptors, etc., that are less risky than others?
Yeah, that's a good question. And of course, I didn't go into medications as that would be many more hours of talking. But based on sort of these guidelines that we have, there are medications that doctors know to use first before other more complicated medications that might require other special testing, like I mentioned, or a subspecialist. But really, the calcium channel blockers, ACE inhibitors, angiotensin receptor blockades, and something called water pills or diuretics. Those are the 4 classes of drugs that we call first-line drugs. So we recommend that you get on all 3 of those if needed before getting on something else, unless, of course, you have an allergy or some sort of side effect to those drugs. But from a risk perspective, no, they're not risky. They're all excellent drugs for high blood pressure, and you can just individually work with your doctor to discuss the pros and cons of each and why you might want to start with one or the other.
And doctor, the second part of the question is of those new drugs that you mentioned, and what's the mechanism for those drugs?
Yes, that's out of the scope of this talk, but there are a lot of different ways. One targets a certain molecule in the pathway in the liver. Some of them attack a certain hormonal stress pathway in our body. But yes, there are certain ones that affect certain receptors. There's a lot of different mechanisms that each of them target. And that's the whole idea that high blood pressure is really because of many different mechanisms in the body, and each of these drugs sort of tries to target a different pathway.
So, okay.
But yes, I'll leave it at that, or it'll get very complicated.
And one of the online participants asked about an infogram that was shown on the screen, but I think we will be publishing that on YouTube later.
Yes,
so that it'll be,
this video will be on YouTube, but a great resource for patients is the American Heart Association, and most of the infograms that I provided was from the American Heart Association.
Okay. And any more questions from the audience tonight?
Oh, I have another question.
Sure.
I'm Greg Martin, by the way. So when blood goes through the kidneys and gets filtered, can you tell me, does it go through both of them, and do both kidneys have the same role and function exactly
Yes.
the same, or is one does one process and
No,
another
both
does
kidneys have
the
the same role, the same function. Blood should be going through both kidneys. We sort of think of them as one.
Does it always go like through the left kidney first and the right?
No, I wouldn't think of it that way. Yeah, I would just think of both of them getting the blood, and both should be working, equally and doing the role. Of course, there are diseases where some people might have a diseased one kidney, and then it would be different. But for majority of the general population, when we think about kidney health, we think of both kidneys being diseased or both kidneys being healthy. Yeah, does that answer your question? Yeah.
And then this one question says, does medication help lower blood pressure? I think you partly answered that already.
Yes, yes. We target those risk factors, the ones that we can modify. But if your blood pressure is still high or too high up front, we go right away to medications, because the medications lower blood pressure, and unfortunately most patients need to stay on blood pressure medications for most of their life, because like I mentioned, as you get older, your risk, because of changes that happen in your body, your blood pressure also just gets harder to control as you get older. So that's why the medications are usually needed to keep the blood pressure down, and usually something that you have to take for a long time.
Okay. Oh, thank you. Okay. How often and what time of the day should blood pressure be checked?
Yeah. I usually recommend in the morning when you wake up after you use the restroom, before you take your meds. And if you want to take it twice a day, I just say morning and at nighttime before you go to sleep. But really, don't stress about taking it too often unless something's wrong, unless you feel unwell, or you're noticing numbers all over the place, or your doctor just made a bunch of changes and you want to see if the drug's working. But it's just hard with work and life to really squeeze in time to check your pressure multiple times of the day. So I say 1 to 2 times a day for most patients. Yeah.
Okay.
Yeah, of course.
When you work with patients on lifestyle modification, what sort of timeline do you normally start with before you move on to the next?
Yeah, usually the recommendation will be 3 to 6 months for like lifestyle trial. Of course, with my job, patients see me who are very, very severe hypertension or come to me on multiple drugs. But if the question is really, if you do want to give lifestyle a chance, give it 3 to 6 months. But again, if you're in the lower ranges, if you're quite high, we might say lifestyle plus drug right off the bat, because we might feel it's too risky to keep your blood pressure so high without medications. But again, of course, over 140. Yeah. Great question.
Okay. Thank you. And this is an interesting one. I thought of this myself. Does drinking lots of water affect or help hypertension?
No, that's a great question. I would no. I would just say drink to your thirst. Drink as much as you like. A lot of the drink 8 cups a day, or drink too much or drink too little. There's a lot of myths around water, is what I'd say. But as a kidney doctor, I say stay hydrated. Listen to your body. Most people might drink 45 to 60 ounces a day if you're not very physically active, and you'll drink more if you're more physically active. So just listen to your body, but not specifically linked to your blood pressure. I would say more just for general health and kidney health. So if you drink more water, it's not going to lower your blood pressure. I would say eat less sodium. That will help your blood pressure.
And for people who are elderly, should they target a different set of numbers?
For blood pressure? No, that's a great question. And like I said, we look, for most patients, we say less than 130 over 80. And again, a lot of that big study that I mentioned where, it helped patients. A lot of patients were elderly and benefited from lower blood pressure. But with more intense lowering of blood pressure, there was also more side effects to drugs in the elderly. So I would just say work with your doctor. Some of my elderly patients, I might accept 140, I might accept 150 depending on their age. I may not be as strict about less than 130. So it's really an individualized decision, but definitely the elderly population is one group of patients where I might liberalize my goals a little bit more, my target.
Thank you. Oh, and then, this is an interesting one. When you measure your blood pressure, does it matter is the left side or the right side?
Yeah, I would say measure both, and hopefully they should be similar. Otherwise, use the one that's higher. And for the most part, your reading should be within a few points of each other. If you're noticing wide discrepancy in your arms, another thing to mention to your doctor, because that might need to be investigated further.
Okay. And this is really interesting. 1, 2. Is it possible to have a high systolic number?
Yeah.
And then while your other number is normal?
Yes, and we do see that a lot too, where the top number tends to be more elevated, especially as we get older. So we really do, target that top number long term when we're treating high blood pressure. If your top number is like 160 and your bottom number is like 80, I'm not going to say, great, you're 80, we don't need to do anything. I'm going to be worried about that 160.
Okay, we're coming up to the hour pretty soon, so I'm going to have maybe 1 or 2 more questions.
Sure.
This one says, does the cuff size have an effect on the reliability of the reading?
Yes, so really that's why I always recommend that when you get a blood pressure machine and a cuff, take it to your doctor, at least once every year or 2 to just make sure your cuff size, get it checked out, make sure the cuff size is accurate, make sure your machine is accurate, because if your cuff is too loose or too tight, it will artificially lower or raise your blood pressure. So it's very important that you have the right cuff size.
Okay. And this is diet related. What is the role of sweets, I guess sugar and also candy and so on, play in the blood pressure numbers? And there's a second part, but I'll let you answer the first part.
Yeah, I really think, diabetes and high blood pressure tend to go hand in hand. Obesity and high blood pressure tend to go hand in hand. So I think it's just this sort of indirect effect that if you have a diet that's high in sugar or processed stuff, it's going to potentially lead to weight gain, diabetes, and then sort of indirectly also affect high blood pressure. So it just really, I think of like healthy foods, unhealthy foods. Everyone's allowed to cheat, right? You wanna, or just do things in moderation, but really sodium is the big culprit directly for high blood pressure. But in general, I would just say with anything that you're eating that's processed, or who knows if there's hidden salt in it, but also like sugary foods will contribute to weight gain, which will contribute to high blood pressure.
Okay. And then the second part of this question, and I'll make this the last question. What about seed oils and having too much polyunsaturated fat but not enough omega-3?
These are getting more into heart health and cholesterol questions. So, really just, not directly high blood pressure, but just eating healthier oils, healthier fish oils, all that just links into better heart health. More unhealthy fats, again, it leads to cholesterol, weight gain, heart disease. So it really just goes hand in hand. Healthy diet just in a way fixes a lot of problems and will also help high blood pressure.
Okay, great. Yeah. And so thank you, Dr.
Bahrainwala,
for being here tonight. And thank you for the audience for being here and asking all these good questions, and the audience online that have been sending in questions in the Q&A chat. Thank you.
Thank you so much, everyone.
This lecture has been recorded, so we'll be pushing it out on YouTube fairly soon. And so watch for that. And then thank you again. And good night, everybody. Good night from the Stanford Health Library. Good night, everyone.
Thank you.